Thank you very much for joining me for Patient Pulse 2025. This webinar is where we're presenting the state of marketing in private healthcare, research that we started last year and gained momentum on this year. And we're really excited to be bringing you the results of this today. There will be a full report which you'll be able to see and download separately. And you'll also be able to see a copy of the recording. So I know there's a few AI note takers and people frantically taking notes, but don't worry, all of this will be provided afterwards. So first of all, I'm Steve. For those that don't know me, I'm Managing Director at Figment. Figment's a family-run digital agency established in 2006. We work exclusively with expert-led businesses who typically get most of their work from referrals, but they want to grow, and they have challenges with knowing where to go and how to generate more inquiries and getting the right patients through to their clinic. So what we do is we help them translate their expertise online, helping them to become the answer in search, AI, and beyond. And our approach has proven to create steady, sustainable stream of new inquiries, which in turn helps people to grow without that overwhelm and stress, which ultimately allows people to focus on what they do best. The reason why Emma, my wife of 9 years, who's pictured there, and I are so passionate about private healthcare is that we both went on fairly significant health journeys that resulted in delayed diagnosis and treatment. And when we went in search to find answers, we did connect with some really good experts, but we both could have had better treatment, better clinical outcomes, and faster treatment if we'd got the answers quicker and more effectively. And so that's what's propelled us on a mission to work with private practices. So we'll start with an overview of the research, which was led by Emma. And the main thing really is that we understand the pressures that the market is going through. It's hard to grow because it's crowded. And at the same time, patient expectations, long NHS waiting lists, and fast changing digital behavior and AI are all adding to the melting mix that makes it a challenge to run a practice in 2025. And the whole purpose of the research is to show a really clear picture of how clinics across the UK are marketing themselves in today's evolving landscape, allow clinics to benchmark where they are against others in their sector and what they can do to improve, and give decision makers data-backed benchmarks that can guide marketing investment and innovation going forwards. So the approach that we took was a combination of secondary and primary research. In our secondary research, we reviewed market reports, news sources, and healthcare databases that covered everything from market size and growth to patient behavior, NHS pressures, emerging technologies, patient behavior, and insurance trends. With our desk research, we conducted a very large-scale review, looking at technical aspects of how patient websites are performing, looking at aesthetics, clinics, wellness, diagnostics, therapies, primary care, and other specialist treatment sectors. And we gathered all of this and put it into a format that is now presentable in our report. Now, our primary research was challenging because we only had a 1% uptake, which illustrates how busy people and HCPs are in general. And we got 30 responses from our survey, which is way below what we set out to do. And when we run this again in the future, we hope that more people will know about this.
Lexi Office's Google Ads account?
Bo, do you mind switching on to mute? Thanks. With primary research, we also interviewed 10 of the 30 directly on a one-to-one basis. These were longer interviews, typically 20, 30 minutes in length, where we really got under people's sentiments around marketing. And this is really important because it helped us to draw out some really key trends in how people are viewing marketing, what they're doing, and where challenges are. And the interviews were a mix of fertility, aesthetics, diagnostics, addiction therapies, mental health, and primary care. So in terms of the market overview, we know that the market is enormous and it's growing, expected to be worth 13.8 billion this year. But there are problems. You know, the pressure in the private is driven actually by NHS delays and rising patient demands. The NHS is at limited capacity, and it's forcing people to look elsewhere for faster, better results and clinical options that are not necessarily available quickly on the NHS. So it's born out of that frustration. And we know that there's a record uptake at the moment in private medical insurance with over 4.5 million policies. So this suggests that employers are taking note of this and they really want to make sure their best staff are well protected and they don't have to go through long waiting lists. Self-pay is also booming. And for example, hip replacements grew from 17,000 on the list in 2019 before COVID to 30,000 right now. And all of this and all the data sources will be available in our report. So with really long wait lists, it's forced people to act. There's over 7.7 million different treatment pathways. And there are shortages everywhere. It's created a huge backlog. And for many people, the idea of waiting just isn't really an option. It's especially true for younger patients. Around 44% of 20 to 39-year-olds say that they would consider paying privately just to avoid the delays. But the catch is that half the population said that they will not take full private insurance. And that's where it's really important to have flexible one-off pricing and look at affordability from a clinical standpoint of view. So in terms of the sector, we know that there's more than 500 private hospitals in the UK and over 32,000 specialist practices, covering everything from diagnostics and surgery through to aesthetics, mental health, and this demand isn't spread evenly. It's really highest in areas with older and more wealthy populations. And London accounts for nearly a fifth of all the private clinics in the United Kingdom. And as more patients go private, they're becoming more selective in terms of what they want, and they want strong pricing, but they also look for expertise, and of course that's where you come in with your experience. And it's not about availability; it's about transparency, it's about experience and trust. Clinics that can deliver these fronts are the ones that are going to stand out. So I mentioned how we looked at over 4,000 clinical websites using a mix of different data sources and tests. We, of course, used AI, and we looked at the findings to try and draw out how patterns were emerging and where pain points might be. This audit has really helped us to understand how clinical websites are set up from a technical standpoint of view and where the gaps are to be able to future-proof for the new era of AI search and beyond. And the sample sizes vary across tests. Not all tools were 100% accurate, and we do have to take some of these tests not as 100% accurate, but as a guide. But the sector is clearly still very reliant on websites that are powered on the open source WordPress platform. So based on over 3,000 sites that we reviewed, 75% of them use WordPress, presumably, and we're big fans of the platform for its open source ability to change flexibly, to own and be able to do what you want with the code and to be able to make it work custom for your own clinic. And it's really important that you get the right platform because when we have practices that we see where they don't work with an optimum technical platform or technical stack, it does result in issues down the line, whether they are to do with Google's health principles, what they call the core web vitals, implementing code within the website that allows search engines like Google to understand it, which is what we call structured or schema data, schema markup. And of course, not having the right platform does create security vulnerabilities. So it's so important to have a right partner around you to make sure the website is protected against problems. And of course, if you don't have a future-proof platform or you're not working with something that gives you flexibility, this now has an implication on how AI platforms like ChatGPT, Perplexity, and Claude are actually crawling and seeing your website. So if you want your clinic to be seen in AI-powered search, it's really important that your content management system supports one that has a fast, easy, flexible, modern structure that's all based around best practice, not just publishing pages, but actually looking at what the best practices are in the industry. So, in terms of managing those leads and inquiries, we know that getting an inquiry is one thing, and then obviously nurturing that and making sure that people book into the clinic for consultation and ongoing treatment options is really crucial. But what was really revealing is that based on the data sources that we looked at, actually only 5% of clinics have a customer relationship management platform as a definite usage. Now, this is not always 100% reliable, but we can take it as indication that the vast majority of practices are not fully utilizing CRM tools. And of course, the great thing about having a CRM tool is it means that your leads and inquiries and customer database can be much more easily managed. The leading one was Salesforce, and we also saw big uptake for HubSpot, but these are out of the only 5%, 220 websites that actually definitely had clear signs of using a customer relationship management, which has left that essentially people are managing on spreadsheets. So in some cases, people are still working like it's 1999 with data that's not on the cloud, not secure, and not shared amongst their team. And it makes it hard for clinical organizations to work collaboratively and manage the patient flow to streamline communications. And we mentioned earlier about Google's Core Web Vitals. Actually, Google, which has a 90% share of the UK search market, doesn't really give website owners of any description an awful lot of feedback when it comes to how well a site is performing. But one thing it does do is it provides you feedback via something called the Core Web Vitals. And this covers a set of health principles that indicate the quality of a website, how it's performing. And there are three main indicators that we look at, which are the contentful paint, the cumulative layout shift, and how quickly your site is loading with the first contentful paint. And it's really, really important that you get your Core Web Vitals right, because it literally is a bread and butter part of your website setup. And what was really, really revealing is that under half of all websites I looked at actually failed these tests. And those sites and clinics that do prioritize performance can outrank others. And this is really important, not just for traditional search like Google and Bing, but in AI-powered search like ChatGPT, Perplexity, Claude, and beyond. So as you can imagine, we probably get on the phone to these people and ask them how they need help. So booking systems, well, we know that we looked at a lot of different options out there when we were doing our research, and it was really interesting to see that nearly half of these websites actually do not have a detectable booking system. And of course, that puts more burden on reception staff. It puts more burden on practice managers to have to deal with these inquiries. So booking systems can really leverage time back and make it so easy for people to receive automated reminders, and that can avoid missed appointments, and it can allow you to take deposits and so on. So booking systems detected do range, but there was a big uptake for Square appointments. Of course, Calendly is one that's also known, but it was quite inconclusive in terms of what the ones that were not detected and which ones were fairly generic. But these are certainly ones that you can look at, and we're also happy to talk to anyone that needs some help with this. Now, chat tools is a big growth area, but 85% of the sites that we looked at in the sector didn't have a chat solution, and the most of those that did were Facebook, and that doesn't surprise us at all. But it means that effectively you could be engaging better with your audience who come on your website. They have questions, and no matter how great your website is, they still want some interaction. And these chatbots and AI powered tools now allow you to capture leads and work collaboratively with teams across your practice so that you can then bring them into your pipeline and into your sales process. Of course, from a patient point of view, this is all about getting fast, personalized information, reducing the friction and making it all work better, faster for them. And in this age of AI powered smart search, people are going to be expecting more and more of this as things go on. Now, in terms of search and social media, we looked at how half of the websites actually had some form of Google tracking script. So that reveals how likely it is that they're going to be running Google ads, but it isn't actually fully conclusive. You can still have the script and not be actively running the ads. And 10% had meta tracking, and meta tracking is used predominantly for Facebook ads. But again, these aren't 100% reliable or definitive. And we can't reliably confirm how many clinics actively run these paid campaigns without doing further digging. But we can say that they do have infrastructure for doing so, particularly with Google. And Meta is still far less adopted, with many clinics struggling to work out how to best use Meta ads to support their outcomes. Now, the topic on everyone's lips is the elephant in the room. It's AI search, and you probably hear different phrases: large language model optimization, generative engine optimization, answer engine optimization. Well, we like to just call it AI search, but the basic principles are that there are 800 million people using ChatGPT, which is the most popular generative search available at the moment. And that market is growing massively. And every single day we see a massive growth in the way that people are adopting and using generative search. Of course, that does present problems because it means that there can be the potential for misinformation. So as clinic owners, it's really important that you translate your expertise and help the data learn off you, because it shouldn't be learning off misinformation. And this is where we all come in. We have a duty to make the internet a better place, not to crowd it with poor information that essentially makes the internet untrustworthy and a dark place. Now, when it comes to this, your bread and butter is to make sure that people can see your website. So what was really interesting is that the vast majority of websites are actually effectively letting them in, but 11% do not let necessarily these AI platforms into their website. So it's sort of the 101 principle of this. Now, it's really important that you structure your website in the right way. So schema markup, which I spoke earlier, is a way of including things like pricing, reviews, and frequently asked questions into your website code that can help it display on the search. Because after all, 60% of all search queries are actually being held before they come to your website, which has really changed the way that people are finding information fundamentally. Now, content drives results. The way that these AI platforms work is that they like really clear answer-led content. And 29%, and nearly a third of these clinics did not have a blog or FAQs. A lot of people say, why should I create a blog? It's all about demonstrating your expertise, authoritativeness, and trustworthiness, translating what you know online. It's not about writing blogs for the sake of it. It's about genuinely answering what people want to know, providing that thought leadership. And of course, there is a plethora of different AI tools that can now fast track that content. But in studies, we've shown that actually human written content through experience and taking more time to do it properly rather than fast through AI actually is 5 times more effective. Now, trust is a big factor in all businesses, and medical is probably the most significant one of those, because effectively this is where people are putting their own health. And it's really amazing to know that half the sites that we looked at didn't have that social proof. We're talking about reviews, testimonials, video reviews, and evidence that you really need to demonstrate now to Google. And since the Medic update in 2018, this has been really fundamental to the way that Google ranks websites. So we spoke about how AI adoption is growing with 800 million people already on ChatGPT. It's actually growing at a rate of about 4% per day. So that shows that it's on an exponential curve. And any practice that isn't AI ready with search is going to be missing prospective patients in the future. So it's really important that you can really properly leverage this, looking at how your site is properly structured, make sure that it's clear and trustworthy. And being optimized for AI search basically gives these platforms the signals that it allows to do these deep searches and deep crawls. So taking action now means you're a first adopter, effectively being first in line to make sure you're found as more and more people turn to AI-based search. So moving on to the survey findings, we spoke to clinic owners, practice managers, and marketing managers, and it's amazing how busy they really are. A lot of people said, it's really interesting, I just don't have the time. And we were only looking for 5 minutes of their time to fill in a really important survey and help to shape this data. Marketing, there are common themes that we picked up. One of them was that marketing typically is a one-person role, and it's regarded as something that's really important. It sits typically with a clinic owner or the practice manager, and occasionally as a dedicated marketing manager. But it's usually alongside other roles, operational, clinical responsibilities. It means that you have to be reactive, inconsistent, and you're often squeezed for time and pressured to spend time doing marketing. You kind of know it's important, but it doesn't necessarily mean you have the focus or time or energy for it. So you can see quotes like, this is just me, really. I try to post when I can, but there's no time for strategy. And of course, we know that referrals are the main way that you get work, whether they're from other medical professionals or previous clients and patients that you work with, and they remain a growth driver. The difficulty, of course, is unless you gamify them, it's really hard to control them because a bit like buses, they come along in large groups and then there's nothing at all. But clinics do pride themselves on reputation, and that's how a lot of us stay in business for a long time. So some clinics that we found were mentioning GP referrals and local networks as the main sources. But then after that, it was digital channels like search, social or paid search and paid advertising as key channels that they work on. And clinics really want to get across the quality of care because their reputation is at stake and competition is fierce. There's more patients looking independently. So it's really important that we look at diversifying the way that we bring practices to patients and help patients go on the journey that they should be going on. So this quote here is, we rely on patient recommendations and we've really never had to advertise. And that's really great until it gets to the point where you just can't grow anymore because either you can't open another practice clinic room, you can't open another location, something dries up. So yeah, we know that budgets are squeezed. Look, we're not in the best economic climate aside from this, but we know that budgets are always very challenging and people want them to stretch as far as possible. People have high expectations. Marketing internally is typically measured in hours and not days. Budgets are extremely tight, support's really limited. And I think the ambition from what we've seen is really out there and people know that they want to be doing more. That's reflected in the number of people that we spoke to and that could give us their time back. But actually support is just so limited, spinning so many plates, barely getting the time off. And we hear things like, we know we could be doing more, it's just there isn't the time or money. Then we know that agencies are mistrusted in some cases. There's a lot of skepticism. This isn't 1999 when I first started off where you would trust anyone that came along because they knew more than you did. There's a lot of skepticism around agencies. Trust factor is low. Some people have been burnt. And I guess that is all really to do with hesitation on cost, clarity, and what results you might actually get. And I think that by this point, people have had other negative experiences or aren't fully familiar with what best looks like. So it's amazing how many situations we walk into where people are misguided. But I guess this is just all about a trust gap. And it points to an opportunity for digital agencies to be more transparent, to make sure that they use AI and maximize efficiency, that can create affordability, and to align with understanding the challenges within the healthcare industry. So clients say things like, we're open to help, but we've been burnt before, and therefore it's hard to justify the spend. Now, we know that there is a fairly inconsistent use of digital tools. So it's not that you can say generally all people within this sector use WordPress and then they use the following three platforms. The technical adoption is just patchy. And I think that it's really to do with not knowing what you should be going or a lack of technical leadership and the fact that everyone's so busy, they can't even make time for technical strategy. So you see quotes like this one, we're still using spreadsheets, it works, but it's not exactly smooth. And all of this creates friction and it limits your ability to scale. And time is the only non-replenishable resource. So we do feel that this is a great opportunity to leverage more time by using these state-of-the-art tools. Now, we have a growing interest in learning and AI. We know that from ourselves. We put up an AI webinar and we have 50 people signed up within just a couple of weeks. So there's more interested in AI at the moment than there is in general marketing, but that's because people do not know what to do with it. And I think there's also a lot of curiosity on how you can get found on these AI search platforms, because whilst there's so many things that you can do with AI, the number one use case has to be the fact that everyone is going to AI platforms to get answers that they previously might have got from asking an expert or for doing a Google search. So that fundamentally is shifting the journey. So content creation and of course making sure your website is really compliant is key. But this is all about future-proofing your visibility. There's definitely an appetite for training, for peer networking and community. And we know that clinics want to be guided. They want to know what's going on. Truth be told, it is a moving train and it's hard to know at what stop to get off. And in fact, this journey is going to go on for many years. But effectively, people who responded and spoke to us do want to know more about how SEO works in 2025 because it is very, very different to how it was back in the day. They want to know that their content strategy is going to survive not just the next 3 or 6 months of ChatGPT optimization, but future-proofing it through all the algorithm updates that are inevitable in the future. How do you stay compliant whilst also being visible? So the interviews really allowed us to get really deep into the sentiments around how leaders are approaching their marketing strategy. As I said, we looked at speaking to founders, practice managers, and marketers of private clinics across a range of different areas, and every clinic is different. You do make everything unique in the people who work, the specialisms that you bring, and of course your clients. But it's clearly that there are strong ambitions to put patients first. But typically marketing is just nobody's job. Responsibilities there, but there isn't resource. And we're seeing that it's usually handled by somebody with clinical or operational duties that may or may not be strongly qualified with a marketing background. And that creates time pressures, confidence gaps, and effectively it affects long-term results. So somebody said, marketing is my responsibility, but it's not my background. Another said, there's no full-time one here, but it's a bit of everything across the team. Of course, reputation really matters. It's what drives trust, and in turn, that drives people's motivation to get in contact with you. Word of mouth still leading the way. Referrals are the biggest driver. So digital is really important because lots of people are not going to be passing by. So they come online, they find about you practice through looking on an internet search, and now, of course, looking on other platforms. We've always relied on our reputation, says one, and then people say that they find us on Google, but we've really done nothing to make that happen. And of course, that can happen. You can appear highly ranked without actually doing any optimization. And this all boils down to how competitive your geographical area is and the services that you operate in, and of course, how well your website may or may not be set up. Clinics want to benchmark and improve. There is that continued professional development that's embodied in who we are, and I think that there is that ongoing desire to grow and to be better and to understand things. And people do want to be empowered. They don't want to just hand it all over to an agency. They really want to understand how it works and make sure that they're doing the right thing. So leaders do want to make sure that they are ahead of the game, and they want to see how they're comparing to others. So this is why our research is really important, because it does help us to get a really good view of the landscape that we can talk to our clients about. And of course, there is an appetite for getting more sector specific guidance, which is, I suppose, why we're in business. This kind of insight is so useful. We don't always know what good's like. And I get that. I completely understand. You don't know what you don't know. And of course, if you ask two different people, you may get three opinions. So it's quite difficult, especially with this industry not necessarily being regulated like other sectors. Now, AI is on the radar, but it's definitely not embedded. We're still really on the early stages. Search, as I said, is evolving. It used to be just go on Google. Now people are looking on AI-based search platforms like ChatGPT, and they're going in to find out information. It's a dangerous space, of course, because people, previously joked about Dr. Google and how it's very dangerous to go looking for medical advice. Online, but ChatGPT could be even worse. And of course, that means that we need to do the right thing, help the AI learn from our own expertise. But yeah, people have told us they just don't know where to begin. They're very curious about how AI will affect search visibility, and they're looking for partners to guide them through and navigate through the shift. So we've heard people say, I've heard of ChatGPT, but I want to make our clinic show up there. And we just want to we would just want to be keeping to the top of Google, never mind what's coming next. And I think that second quote is a bit, it's a bit concerning, because it doesn't indicate a good understanding of where the landscape is going. Google's market share is very much likely to drop down, currently from 90 and already dropping from 92. It will be dropping down, and I fully expect that we will be seeing a lot less traffic going through Google search. But at that point, it will be more trusted. Online care is really strong, but offline care is really strong, but online presences don't always reflect the quality of the care. You know what's really amazing? I speak to practice owners and managers and entrepreneurs who run companies, and when I go into their practice, their online presence doesn't match. And I think that patients need to see that experience on the website now, and it can be a challenge. How do you translate the look and feel, the trustworthiness, and everything across to the internet? We must put patients first. So patients telling us that, practices telling us that the patient experience is their top priority. And they do want to drive more people to see them face to face. But of course, since COVID, there has been a rise in digital healthcare. There's clearly a big gap in clinic standards and in digital experiences, and that is a great opportunity to close it. So they say we're all about patient care, but our website doesn't reflect that. I don't think our website presence matches the quality of our clinic. There's definitely opportunities for support and collaboration. Clinics are open to outside help, but there's a lack of trust, and definitely past experiences have made people feel more cautious. They want partners that really understand their day-to-day work, and they understand the drivers and how the market is moving, and that they can show clear value. There's definitely an opportunity to learn. People want to do that through peer networks, and it's an opportunity to better share knowledge. A lot of practices work in silos, and they don't always get together with other practice managers or other marketing teams at other practices that are not competing to discuss ideas. And that's definitely an area that we're looking to work in. We said we tried agencies, but they just didn't get our sector. We like to do more educational content, but we don't want to overwhelm or scare people. And something like a round table, I would definitely go. So to conclude, clinics are definitely under a lot of pressure, but the opportunity here is wide open. The industry is growing, but it's noisy and it's hard to stand out online. There's a definite lack of having the time, resource, and clarity, lack of partnerships that are meaningful that can help you grow. And even in 2025, people are still marketing like it's 2015 with fairly pre-outdate, prehistoric type setups. But the good news is that if you make small focus changes, looking at where your quarterly wins can be, you can have an impact. And it's difficult to know where to start sometimes, but think about your goals, make them smart, specific, measurable, attainable, time realistic, and make sure that you look at your customer journey, how people find you from the very first step, pre-awareness, through to advocacy, loyalty, and recommendations and beyond. And then map all of the key questions that you get asked. And what's amazing is how many times we find out that questions are being asked at a consultation level that could have been better answered on the website to some degree. And the focus has to be on trust and ultimately providing the best patient experiences. And the space is wide open. People are going to be expecting the website to do more than just act as a brochure site in years to come. So you must take action because the landscape is moving at the fastest pace of change that we've seen in the last 20 years. So your top 5 takeaways: marketing lacks structure and time is the biggest barrier. Clinics are reactive. You're squeezed around other roles. There's an opportunity to introduce systems that are simple, repeatable, and they can lighten the load for you and support your growth, especially if you're stretched internally. Referrals are strong, but on their own, they're not enough and they do present a growth risk. Word of mouth is the main source for new patients, but you can build on this strength by adding digital channels that increase your visibility and support your growth over time, helping to support all the different stages in the marketing funnel, from initial awareness through to conversion and loyalty and beyond. Digital foundations are massively underdeveloped. Clinics are typically lacking technical leadership and they struggle with visibility on search engines and then understanding how to best leverage paid ads. So those that invest in the right areas can get ahead while others are still catching up. There's a strong interest in AI adoption, and this is in general, but from a marketing standpoint of view, the biggest opportunity is to make sure that you're going to be showing up in ChatGPT, because that really is where people are starting to look. And this is all about ensuring that you have a really strong content creation workflow, that you communicate with your patients the way that you want them to see your clinic. And it's really important that you understand how AI platforms do their deep crawling and research to pull up and help you become the answer. And then peer learning is in demand. So everyone wants to know more. There's obviously a shortage of time, but there's definitely a big willingness to connect, to share, and to learn from others. So what now? You can definitely take away our report, which will be available for download, and benchmark your clinic. And you can share these insights with your wider team. Pick one area to improve this quarter and start there. And of course, if you do need support, we're happy to help, whether it's strategy, visibility on search and AI, or systems integration. We're happy to help explore how we can best help your practice grow. And I have a clinic that you can book into where you can have a one-to-one specifically with me to discuss your challenges. And if you would like to pick up this, you can scan this QR code. We'll send over this link as well, where you can book in a one-to-one call with myself, where we'll look at how we can best support your growth goals and put you, if we can't help you, we'll put you in the right direction. Thank you very much for coming today to the live webinar. I'm sure that you found some value along the way, and I really appreciate anyone that was involved in the study and shaping it from the start. especially Emma, who led the project and put her heart and soul into it over the last 12 months. And for everyone that is interested in receiving a full copy of the full report, we'll be sending that out straight after this. And we'll also be inviting you to a seminar where we'll be discussing these topics as a forum. And this is a great opportunity to be sharing ideas and to be making sure that we can collaborate and help support each other along the way. So from me, from everyone at Figment, I do really appreciate your time. And I think you might be going off on your lunch breaks or maybe just squeezing in a quick sandwich. But I really hope that today was the most valuable for you. And I will see you again very soon. Bye for now.